Okay, so today we're going to talk about the parts, surfaces, and muscle attachments of the femur. Okay, so this is anterior view of the left femur. We know it is anterior because we see this smooth surface. We see the patellar surface, and on the posterior surface we see the linea aspera. Okay, it's a rough surface, and we also can see the condyles very obviously, and also the popliteal surface. So this is a posterior view of the left femur. Okay, the head goes that way, so it is left, and this is anterior view of the left femur. Okay, the head goes like that. Alright, and now talking about the parts. This is the head. Okay, so this is the head of the femur, a spherical head, and in the center is the fovea capitis. Fovea capitis for attachment of the ligament of the head of the femur. Below the head is neck. So this is neck of the femur. Okay, this is neck. Neck. This is head. Like that. This is the greater trochanter to the lateral, and to the medial is the lesser trochanter. So see, this is greater trochanter. All of that. See, greater trochanter, and this is the lesser trochanter. Between the two trochanters anteriorly is the intertrochanteric line. Okay, intertrochanteric line. Posteriorly between them is the intertrochanteric crest. Intertrochanteric crest. Here we've got a fossa. This is the trochanteric fossa. Trochanteric fossa. Okay. Trochanteric fossa. All right. And on the intertrochanteric crest, we've got a tubercle, which is called the quadrate tubercle. Quadrate tubercle. For insertion of the quadratus femoris. Okay. This was about the upper end of the femur. We also have the shaft and the lower end. The shaft of the femur anteriorly is just a smooth surface, but posteriorly we've got some important spots. This is the gluteal tuberosity. Gluteal tuberosity for insertion of the Gluteus Maximus muscle. Insertion of a part of the Gluteus Maximus muscle. This ridge over here is the linea aspera. Linea aspera. Okay, so if there's a spot on this, we'd say that this is the linea aspera. The linea aspera continues below as two supracondylar ridges. This is the medial supracondylar ridge and the lateral supracondylar ridge. The medial supracondylar ridge ends as the adductor tubercle. Okay, adductor tubercle for insertion of the adductor magnus. This is the popliteal surface. Popliteal surface. And in the lower end, we've got some important parts. We've got two condyles. This is the medial condyle. Okay, so posteriorly, this is the medial condyle, and again, anteriorly, this is the medial condyle. Okay, medial condyle. And this is the lateral condyle. The lateral condyle. Lateral condyle. So, in between is the intercondylar notch. Intercondylar notch. This is the medial epicondyle. Medial epicondyle. This is the lateral epicondyle. Lateral epicondyle. So it is always important to identify the medial and lateral by looking at the head. Okay, so the one that is in line with the head is medial. The one further away is lateral. Okay, so medial condyle, lateral condyle, medial epicondyle, and lateral epicondyle. Alright, and as we said, this is the patellar surface. Okay. That should be all about the parts and surfaces, and now moving to the attachments of the femur. Okay. On the anterior surface, this is vastus intermedius, articularis genus, this is vastus lateralis, vastus lateralis. This one is short head of the biceps femoris. It's important not to confuse between them, okay? This one is short head of the biceps femoris. This one, however, is the vastus lateralis. This is vastus medialis. Vastus medialis. Here, on the greater trochanter, we've got many attachments. We begin with the key muscle, which is the piriformis. This is the piriformis. On the tip of the greater trochanter is the piriformis. This is obturator internus, gemellus superior, and also gemellus inferior. But mainly it is obturator internus. Okay, anteriorly on the greater trochanter is the Gluteus Minimus. Rather posteriorly on the greater trochanter is the Gluteus Medius. And here again on the Gluteal Tuberosity is the Gluteus Maximus. As we said, on the Intertrochanteric Crest, we've got the quadrate tubercle. So this is Quadratus femoris. Quadratus femoris. Here, close to the Trochanteric Fossa, we've got the Obturator externus. Obturator externus. The only attachment on the lesser trochanter is the iliopsoas. Okay, they are two muscles actually, the iliacus and the psoas major, but they have one insertion, so we say iliopsoas. This is pectineus. This is adductor magnus. This large insertion, okay, right next to the origin of the short head of the biceps femoris, we've got insertion of the adductor magnus. Adductor magnus. And next to that, we've got two insertions, respectively. See, this one is adductor brevis, and below is the adductor longus. So, adductor magnus, adductor brevis, and adductor longus. This is all about the muscle attachments of the anterior surface of the shaft, the upper end, and also the posterior surface of the shaft. And now on the lower end, we've got some attachments. This is the lateral head of the Gastrocnemius. Okay, this lateral head of the Gastrocnemius muscle. This larger one is the medial head of the Gastrocnemius, and this is plantaris. This is Popliteus. Popliteus. So again, to determine the medial and lateral heads of the Gastrocnemius, it is important to look at the head. See, the head is medial, so this is the medial head of the Gastrocnemius, lateral head of the Gastrocnemius. And again, this is adductor magnus. See? Adductor magnus all the way down and also goes into here. Adductor magnus on the adductor tubercle of the femur. Okay, now we're gonna talk about the muscle attachments of the femur and the nerve supply, and also very little about the attachments of the tibia. So this is anterior view of the left side. This is the left femur. This is the left tibia, the left fibula, and this is the left patella. This is the ligamentum patellae that attaches the patella to the tibial tuberosity. Okay. Now about muscle attachments of the shaft of the femur. Anteriorly we have vastus intermedius, articularis genus, which is again considered part of the vastus intermedius. To the lateral is vastus lateralis. To the medial is vastus medialis. These are all heads of the quadriceps femoris, and they're all supplied by the femoral nerve. Okay, and posteriorly on the shaft, this is Gluteus Maximus. Okay, and on the upper part, anteriorly is the Gluteus Minimus. Posteriorly is Gluteus Medius, and this is Gluteus Maximus. The Gluteus Maximus is supplied by the inferior gluteal nerve. However, the Gluteus Minimus and the Gluteus Medius are supplied by the superior gluteal nerve. Again, on the shaft posteriorly, we have a short head of the biceps femoris, which is supplied by the common peroneal portion of the sciatic nerve, because it is lateral. Okay, and this is adductor magnus. It's adductor portion, and this is adductor magnus. It's hamstring portion. So the adductor portion of the adductor magnus is supplied by the obturator nerve, because it is considered part of the medial facial compartment of the thigh. The hamstring portion of the adductor magnus, which is considered part of the posterior facial compartment of the thigh, is supplied by the tibial portion of the sciatic nerve, because it is medial. And this is this is adductor brevis, and below is the adductor longus. Again, these are both supplied by the obturator nerve. And this is pectineus, supplied by the femoral nerve. And now let's move to the upper part. We talked about this, which is the Gluteus Minimus and Gluteus Medius. Okay, and now here on the tip of the greater trochanter is the Piriformis, which is supplied by the first and second sacral nerves, and close to the Trochanteric Fossa is the Obturator externus, which is considered a muscle of the medial facial compartment of the thigh, so it is supplied by the obturator nerve. Obturator externus, close to the Trochanteric Fossa, and just in front of the Piriformis, we have insertion of three muscles together: obturator internus, gemellus superior and gemellus inferior. and they are all supplied by the sacral plexus. Okay, and one thing here, again, on the Intertrochanteric Crest, we've got the quadrate tubercle for insertion of the quadratus femoris, and the quadratus femoris together with these three muscles, the obturator internus, gemellus superior and gemellus inferior, are supplied by the sacral plexus. And on the lesser trochanter of the femur, we have the insertion of the iliopsoas muscle. The iliacus is supplied by the femoral nerve. However, the psoas is supplied by the lumbar plexus. And that should be all for now about the femur. And here on the tibia, we've got some insertions that are important to differentiate. So see, on the upper medial part of the shaft of the tibia, we've got these three insertions. This one is sartorius, this one is gracilis, and this one is semitendinosus. This on the medial condyle of the tibia is semimembranosus. So semimembranosus and semitendinosus form the medial part of the posterior facial compartment of the thigh. The semimembranosus goes shorter to the medial condyle of the tibia. However, the semitendinosus goes farther to the upper medial part of the shaft of the tibia.